In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the National Medical Taskforce for Combating Coronavirus, His Excellency Dr. Walid Al-Mana, Undersecretary of the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, and Dr. Jamil Al-Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now, as usual, we begin with Dr. Walid Al-Mana, Undersecretary of the Ministry of Health. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within his knowledge. Praise be to him for his countless blessings and grace. And praise be to the Prophet. Again, we welcome you to this press conference through which we aim at informing you on the most recent updates regarding COVID-19. We have 3 or 4 pillars. Number 1, we're going to review the mechanism for the alert level traffic light system for COVID-19, through which we can decide whether to open or close the sectors in the Kingdom of Bahrain. The second pillar, we're going to talk in details about the treatment protocol used for COVID-19, which is sotrovimab. And third, we're going to talk about the booster dose and the vaccination for children. And the last pillar, we're going to answer some of the questions regarding the traffic light system. Well, recently, thank God, we have witnessed a remarkable gradual reduction since 27th of May up to yesterday. As for 27th of May, the active cases were 26,883, up to yesterday was 3,188. So we had a reduction of around 88% in the active cases. This shows the responsibility and commitment of society and the initiative to take the vaccines and also taking the booster dose. So everyone have to continue their commitment everywhere, whether we are in the red, orange, yellow, or green levels, because moving between these is a responsibility for everyone. And we have to confirm that when opening some sectors, it doesn't mean like we have eradicated the virus and everything is fine. And hopefully everything is fine. And then we got the false sense of security. And this is what we alert everyone. So maybe people would think it is safe and so they go reckless. No, it's the opposite. We have to strengthen our determination to implement all the precautionary measures and take the vaccines. So let's review the traffic light system, which we are going to decide whether to close or open the sectors. We have 4 levels based on the average percentage of existing cases, in addition to the capacity for ICU. First, the green level, when the average percentage of active cases for a period of 14 days is less than 2%. The yellow level is when the average percentage of active cases for 7 days is between 2% and less than 5%. As for the orange level is when the average percentage of active cases for 4 days is between 5% and less than 8%. And the last one, which is the red level, is when the average percentage of active cases for 3 days is 8% or more. Now, moving from one level, moving downward from the one level to another would require staying at the same level for no less than a week, but moving up from one level to another would not require completing the specified period. For example, it is possible to directly move from the green to the red level without going through the yellow and orange levels if the data indicated the need to. And also for this, traffic light system is subject to change according to data and developments. And sometimes certain occasions would be designated by the committee would not be subject to this light system if it requires so. So to conclude, I remind everyone that each individual of the society is responsible for reducing this active cases, and it affects the society as a whole. Now, I'll leave the floor to Lieutenant Colonel Dr. Manaf Al-Qahtani, infectious disease consultant at the BDF Hospital, who's going to talk about the details of the Sotrovimab. Please proceed. Thank you very much, Dr. Walid Al-Mana. In the name of God, most gracious, most merciful. Good afternoon, everyone. Today is Thursday, so we're going to talk light. Well, moving on to what Dr. Walid Al-Mana mentioned, who explained the new mechanism for sensing the risk of COVID-19, which hopefully will going to be a successful mechanism and a flexible one as well. Well, what Dr. Walid Al-Mana mentioned was important. We need to have a general system for sensing the risk of COVID-19 as mentioned by Dr. Walid Al-Mana in details. My speech today is like I need to confirm and comfort everyone that we also have a treatment protocol and that the Kingdom of Bahrain always on top to get the updates regarding treatments. So we always looking for the best treatments. We talked for like around 17 months about the treatment protocol in Bahrain and the precautionary system, and now we're talking about a new way of treatment which is different but have the same antibodies, which is using the antibodies through the IV fluids. In the Kingdom of Bahrain, we recently started the clinical trials of antibodies, and we had certain people which proved the effectiveness of this treatment and reducing the symptoms and also reducing the number of death cases, which also encouraged us to look for the best treatment, which is a new treatment, and Bahrain is among the top countries which invested in this, which is Sotrovimab. Basically, it is a medicine which is entered through the body through the IV fluids, and it provides antibodies that are manufactured in factories. So these antibodies are already manufactured. So the difference is that it takes the vaccine will take like 10 to 14 days, but if somebody got the infection, the vaccine is not going to be the protection, but we need to accelerate the process of creating the antibodies. So here comes Sotrovimab that would protect the body from the virus, because once the virus gets into the body, it would get spread in the body, and the body will be exhausted, and then it might goes into like the hospitalization. So the use of this treatment is it will stop the virus from being attached to the cells of the body and will not require the person for treatment, and hopefully from not having any death. So we used this treatment in June 17th, and since we started it, we had around 223 used this treatment. So the way we use it, we have set a center, a Shamil Med Health Center. We have 200 beds, and thank God we did not use most of them, and because it's like for short-term admission, and people, they don't need to, once they come to a Shamil Center, we ensure their data, we ensure their infection, and we ensure that they really need the medication, because there are things we keep in mind among them, because people can take it as long as they are 14, among over 12 years old, and they are who weight at least 40 kg. So those with severe symptoms and they need oxygen, it would be too late for them. That's why we use this treatment at an early stage of the infection. So they go enter into hospital for 1 hour, half an hour for the IV fluid, and the second half an hour to follow up on the status of the patient. And the supervising team will look into the case for the first day and the 5th day, and maybe for 10 days. And if they used it for more than, if they had like 14 days of infection, we have to follow up on them. So we only had 2 cases. Thank God the admission was very short, less than 4 days, and the oxygen level was high, and they did not need to go into the ICU. Those who got into the ICU only who had chronic disease and over 50 years old. So to conclude, we reiterate that COVID-19 is among the viruses which are mutating, meaning that they will continue changing as long as there is spread. So our duty is to commit to the measures in order to combat it, and we have good news so far. But just to remind you, the spread or not is based on our behavior. We decide which level we go to based on our behavior. Now, I'll leave the floor to Dr. Jamila Salman, infectious and internal disease consultant at Salmani Medical Complex, to talk about the 3rd pillar. Thank you very much. Dr. Manaf, peace be upon you. In the name of God, most gracious, most merciful, we welcome you in this 3rd pillar, which I'm going to talk about 2 points: the updates of the booster dose and the vaccines for children. First, to remind you that the commitment of everyone is necessary, and to implement all the instructions in order to gain the success, and which will support the mechanism explained by Dr. Walid Al-Mani, which is the traffic light system, and it will achieve the targeted objectives and hopefully reduce the active cases. As for the vaccine, we are continuing the vaccination campaign in order to create the herd immunity and hopefully to combat this pandemic. Let me talk about the booster dose. We have 3 points. First, everyone must take the vaccine at this important stage, whether in the Kingdom of Bahrain or abroad, with having the mutation in order to reduce the complications and the death cases. Number 2, to take the initiative and register for the vaccine. And third, for those elderly and those mostly exposed to COVID-19 symptoms, to take the vaccines and the booster dose, because those who took the Sinopharm, they have 2 options, either Sinopharm or Pfizer, and so they can take the booster dose. The second thing, those who are not from the elderly or those mostly exposed, they will be contacted and they will have appointments arranged for them after finishing the 6 months of the second dose. And this takes us to the second point. We talked about the variants and recently the Delta, which spread in most of the countries around the world, and it causes risk among all categories of ages, and the best means of protection is vaccination. And we thank you everyone for registering for the vaccine, especially registering for your kids. And the statistics in the Kingdom of Bahrain showed the large number of those registering for the vaccine, which have reached for these children 49%, which is like half of the those eligible, which is a good percentage. And we note that any news about the risks of and danger of the vaccine for children is not yet scientifically proven, and the FDA and CDC in the United States have recommended to take the vaccine for these age category for children, and there were no complications. And last but not least, there were no complications or severe symptoms for those who took the vaccine for this children category. So we stress on the importance of taking the vaccines for this children category. And to conclude, we call upon everyone, as usual, to responsibly commit to the following: the precautionary measures and all the guidelines that we got used to, in addition to take the vaccine. And hopefully soon we're going to eradicate and combat this virus and reduce the active cases. Thank you very much. Thank you very much, the speakers, for your briefs. And now we take the questions from the journalists. I think, Mr. Ali, we move to the fourth pillar, which is related to the answering the common inquiries we received from citizens and residents from different platforms through the email or through the mostly common questions on social media about the traffic light system. So we're going to review these, and later we're going to have the questions from the journalists and reporters. Now we have 3 questions. First, is the yellow level means going back to work and canceling working from home? Well, the yellow level implements the 50% from home for government entities. The second question, for travel procedures, well, are they going to be the same or be changed? Well, they are. The current one are effective, and any change will be issued by the Civil Aviation Affairs. And the third question, the decision to open them will have a lot of people going out to markets, and especially upon the coming occasion of Eid. And it's possible that the active cases will be increased, and this could destroy the efforts of the National Task Force. Well, we mentioned some occasions are not going to be, we're not going to implement the traffic light systems because we have the risk of the gatherings, and upon the coming occasion of Eid al-Adha, that the opening or closure will be assessed by the National Medical Task Force, and they will set their appropriate recommendations in order to protect the health and well-being of everyone and protect the or not according to the secure and safe levels, and the decisions will be decided later. Well, the question is, because we have opened the, people are going out by a large number and this will destroy the efforts. I think, as we mentioned today, again, when we open the markets or sectors, it means we shall neglect the precautionary measures. No, we still have to implement them. And people can go out, but with keeping in mind the social distancing, wearing masks, and not to gather and mingle with people, and going whenever is needed. So I'll leave the floor now to Lieutenant Colonel Dr. Manaf Al-Qahtani to answer other questions. Thank you. Question I had, everyone will be allowed to access malls, and will children be allowed as well under the age of 12? Well, as mentioned by Dr. Walid Al-Mana, is important. So if you can let me explain it. At this stage, we have 4 levels. So based on that, the behavior will determine, compared to the virus, setting the behavior of people into these levels. If we go into red, it means there is a large number of spreading of this virus spread. So many sectors will stop. And if we go into the green, which means that the recovery from this virus, it means the behavior is helping into going back to our normal life, but keeping in mind the masks and all the social distancing will always be there until will be announced. So we have 2 remaining levels, which is like orange or yellow, which means there are behaviors which needs to be adjusted, and if people protected or not. So there are certain requirements for people to go out, or certain people who are not vaccinated. So generally based on the behavior, just to let you just briefly informed of this mechanism of traffic light. As for everyone will be allowed to access the malls, this is based on the level we are in. If we are into the yellow or orange, it means no, this will be limited only for those vaccinated who have completed 2 doses and 14 days after the 2 doses. As for children, if they are below 12 and they cannot take the vaccine, it means they are allowed to access these places as long as there is an adult with them who is vaccinated and who completed 14 days after the 2nd dose. I hope I answered the question. And now I'll leave the floor to Dr. Jamila Salman to answer the other question. Now, number 1, are barbers and salons and cosmetic and spas will be open. This is based on the traffic light system based on the level. If we are in the green level, hopefully we're going to be, yes, we will open these activities for vaccinated and non-vaccinated. If we are at the yellow level, it will be only for those vaccinated and who completed 14 days of the second dose and recovered by showing the green shield, and those who are below the 12 years old, as long as they are accompanied by vaccinated or recovered. If we are at the orange level, then the services will only those who do not, for those services which do not require removing the vaccine at these services, and of course if they are recovered or vaccinated, and for those who are below 12 years old, as long as they are accompanied. So the second question, are we going to wear masks for the yellow and green? Yes, we're going to wear the masks all the time. If we are at the green, we're going to wear the masks and keeping the social distancing in the internal places only. I think we answered the questions. Yes, so thank you very much. Now let's have the questions from the journalists and reporters who are joining us remotely. Question to Dr. Walid Al-Mani from Tamam Busafi Al-Ayam newspaper. With the traffic light system mechanism based on the average percentage, are we going to set a fixed number for the PCR test on a daily basis? Thank you for the question. Yes, there is a level we have to fix because we set an average. If we say like an average or the average percentage of 2% or 5%, we need to have fixed PCR tests on a daily basis, which is like 12,000 to 15,000 on a daily basis. So the PCR tests are going to continue in Bahrain. We need them. It's one of the indicators that we need it in Bahrain. Even if we had the active cases reduced, because they help in maintaining the health and safety of everyone, and it is an alert for us to assess the status in Bahrain. So we're going to be into this. Yes, we're going to fix and sit between 12 to 15,000. It could go up and down, maybe not down, but it could go up based on the active cases. If we have more active cases, it means we need to do more PCR tests. Thank you. Question from Rashal Ibrahimi, Bana, to Dr. Manaf Al-Qahtani. Will the booster dose be regularly on an annual basis? And for those who are below 12 years old is safe? Thank you for the question. To answer the first part, we are still in the assessment level of the virus, of the vaccine. So is it going to be on the annual basis? We're not yet. And there are so many in the scientific society to join the flu vaccine and the COVID-19. So up to now, it's not confirmed by the competent authorities, but definitely once confirmed, we're going to announce it. As for the children below 12 who got to be vaccinated, we still have clinical trials which have not yet been announced on the efficacy of these vaccines for those who are below 12 years old. The current studies and certified and accredited internationally are for those who are 12 to 17. If we can categorize them until under children, but below we still need to wait. As for question from Hassan al-Sitri, Al-Watan newspaper, to Dr. Jamila Salman, how many variants we have in Bahrain, and have we identified any infection with Delta Plus in Bahrain? Thank you for the question. The importance of the question is, scientifically speaking, we talked about from the beginning of the pandemic, all the viruses, including COVID-19, are a possible potential to have variants. And all these variants could be simple and not really like, of importance scientifically or in terms of society. But when is it important? When these variants, we have variants of concern. Why are they of concern? Maybe this is including Delta or other ones which are famous now internationally. You've seen like the WHO have set names for them so they don't relate them to countries, Delta or So these variants are variants of concern. Why are they important? Because once we have such developments, have they changed the spread of the virus? Some variants are more spreading and it could affect the treatment, the vaccination in different countries. So that's why they are of concern. And with continuation of the virus and the vaccination is not as expected, the virus will continue mutating and will have different variants. And there are different categories of variants mentioned by what they call them variants of interest. They are there, but they're not of concern yet, and including different names, but they're not really like famous at this stage. Thank you for the question. A question from Hamad al-Nahas, Al-Bosala Outgate, to Dr. Manaf al-Qahtani. Please clarify regarding the mechanism for those vaccinated or recovered who are coming from abroad and wants to visit Bahrain for a short period of time. Do they, like for 3 days, do they have to apply 10 days quarantine? There is a mechanism for those recovered, for travelers coming to Bahrain, if they are not vaccinated of the approved vaccines in the Kingdom of Bahrain or internationally by WHO, they will have quarantine and the PCR test first day and 10th day, and they're coming from the red list countries, they will still have to issue a negative certificate. If the visit is less than 10 days, then they don't need to be quarantined because they will have the vaccine. The quarantine is not related to the visit to Bahrain. There is a mechanism which was explained on the website of the Ministry of Health. Question from to Dr. Walid Al-Mana from Fatima Ali, Akhbar Al-Khaliji newspaper. According to the history of novel COVID-19, the curve witnessed an incredible increase during last summer. So are we about to witness the same during this summer? Thank you for the question. It is really important. If you remember the news during summer that, they said it would be reduced. So we would say like viruses during seasons, and sometimes with the heat it could be reduced, but we did not notice this with COVID-19. In fact, we had an increase. But what I want to tell you, seasons and the different temperatures could not have like great impact. It's only based on the behavior of people. So if like the behavior of people, the protection in the country people are complying with the measures, they will witness a reduction, whether winter, summer, spring, regardless of the season. So the increase or the wave will always be based on the recklessness of people. So whether summer, up or down, I think a year and a half, we had certain waves which were not related to seasons, and they were in fact related directly to the behavior of people. And I hope I answered the question. I think we answered the questions. Thank you very much to the speakers for your briefs, and thank you very much for watching. Before concluding, kindly be reminded to continue following all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. Thank you very much.